that means. So beta coronaviruses are enveloped positive stranded RNA viruses that infect humans and other mammals. The natural reservoir for beta coronaviruses are bats and rodents. So it's transmitted through respiratory droplets or by close contact, so within 6 feet for COVID-19. So COVID-19 first attacks the lungs. It's associated with fibrinous exudate, which is essentially when the alveoli fill up with fluid. And it's also associated with hyaline membrane formation, which essentially refers up to the buildup of collapsed alveoli in the lungs. So a group that has been found to be largely susceptible to disease and mortality from COVID-19 is the elderly. Previous associations have been made for a decline in respiratory function and decreased activities of daily living, or ADL, and quality of life, or QOL, accompanied by decreased physical and mental function. And it's also been associated with a lack of physical activity among the elderly population, which can be further cause for mental and physical decline. So because of this, it's important to maintain the ADL and QOL of elderly COVID-19 patients who have shown improved respiratory function. The purpose of this study was to investigate the effects of respiratory rehabilitation on respiratory function, ADL, QOL, and psychological condition in elderly patients with COVID-19 who were discharged from the hospital with satisfying results.
So in every study that we're going to read about, there has to be a certain criteria for people that are able to participate in the experiment. For this particular study, the inclusion criteria included patients that were already diagnosed with COVID-19, were 65 years of age or older, had at least 6 months of their symptoms of acute diseases. However, it could not have been any COPD, which is chronic obstructive pulmonary disease, or other respiratory diseases, so that they could appropriately measure the effect of coronavirus on the respiratory lungs. And they had to have an MMSE score of over 21, which is a mini mental state examination, which is basically just a standardized test to test anxiety and depression so that it could be measured across the board. And patients had to have a forced expiratory volume, or FEV, of at least 70%, which is basically just the amount of the percent that a lung can expand in a given time when breathing in. So in this study, it was a open randomized controlled trial. And what this means is that once these participants were chosen to be in the study, a random number generator gave them a specific number, and the odds would have underwent the interventions, the treatments, and the evens did not. So these interventions all were different forms of respiratory muscle training, which included cough exercise, which was 3 coughs measured as hard as possible, which tested the force of the lungs, diaphragmatic training, which is just diaphragm contractions, which are also measured before and after, home exercise, and stretching, which is just casual exercises that were done in an individual basis. So for every study, there's going to be primary and secondary outcome measures. Basically, primary outcome measures are the intended and direct results of the study. It's included in the hypothesis, and it is just exactly what was set out to study. The outcome measures, the secondary outcome measures, are things that may have happened as a result of doing an activity to complete the primary measures. So in this study, the primary outcome that they were testing for was respiratory function. And as I said, this was measured by FEV1, which is the forced expiratory volume in 1 second. Also the forced vital capacity, which is just the amount of air that can be exhaled forcibly from the lungs, taking the deepest breath possible. And the DLCO percentage, which is the amount of CO that passes through the capillary walls. And normally this is above 80%, so they looked out for that. Some secondary outcomes of this were the exercise endurance, which was measured with the 6-minute walk test. That was before and after they measured their oxygen levels, heart rate, blood pressure, respiratory rate, and perceived exertion. And this was however far they could walk in 6 minutes. What was also affected was the ADL, which is activities of daily living, and this was assessed with the functional independence measure scale, which ranged from a maximum of 7 points to a minimum of 1. The quality of life was changed, and this was scored on 8-section short form 36, which is a standardized test after treatment, and the anxiety and depression, which was assessed with the MMSE, as we discussed, and if symptoms worsened to oxygen levels decreasing below 85% or the heart rate increasing to more than 85% over predicted, the study was stopped for the safety of the patients. Finally, every test has to go through statistical analysis to see whether the results are significant. In this study, we looked at the SPSS24 test, which meant that there had to be a minimum sample size of each group, the control and the variable, of 26, power of 80%, and the alpha error was 5%. And this study measured all of these things beforehand and had a sufficient group size of 72 people that participated. Finally, there was an unpaired t-test that we used for variable evaluation such as age or gender so that we can test any confounding variables and make sure that the results are significant.
Okay, so the results consisted of baseline characteristics, results from the pulmonary function test and the exercise capacity test, and then scores of ADL, QOL, and anxiety and depression. So as you can see in Table 1, it's showing the baseline characteristics for the intervention and control group. So as you can see by the p-values in the table, there were no statistically significant differences between the two groups of patients in terms of age, gender, BMI, extent of lung CT lesions, and past medical history, which was desired. So figures in 1 and 2 are showing the results from the pulmonary function tests. So in both figures, the x-axis represents the period of time in which the data was collected in weeks, and the y-axis represents forced expiratory volume in 1 second and forced vital capacity in figure 1, and then the same for figure 2 in addition to DLCO. So the intervention group and the control group were compared after 6 weeks of respiratory rehabilitation. And as you can see in both figures, there was a statistically significant difference between FEV1 and FVC in figure 1, and FEV1 and FVC, as well as DLCO in figure 2. So figure 3 shows the results of the exercise capacity test. So similar to figures 1 and 2, the x-axis shows the length of time in weeks, and the y-axis shows the 6-minute walking distance for both groups. So the 6-minute walk distance after 6 weeks of respiratory rehabilitation within the intervention group was significantly longer than that before the intervention. So table 2 just summarizes all that I've mentioned. So the significant differences in the pulmonary function test and improvements in exercise capacity test. It also shows the ADL, QOL, and depression and anxiety scores. So in terms of ADL, there was no significant difference within the intervention group or in comparison to the control group. Despite that, there were significant differences in the SF-36 scores within the intervention group and between the two groups, and that suggests an improvement in the quality of life. And lastly, the table shows that both the SDS and SDA scores decreased after the intervention in the intervention group, but the only decrease that was statistically significant was in anxiety.
So what this all means is that there were some significant and some insignificant results. This study found that pulmonary function did improve. However, it is possible that this could be due to some other things that happened because of the exercise that were done. So for example, rehabilitation training related to the respiratory muscles that played an important role in respiratory function. Exercise capacity also increased significantly, and this could have been affected by the intensity and physical and mental health previously that patients had existing. The quality of life and anxiety also improved significantly. However, the living ability and depression scores did not increase significantly. And this could have been due to the short duration of rehabilitation, only over a period of 6 weeks, and they didn't have an opportunity to do the study for longer. With every study, there's limitations, and in this one, it's clear that the patients knew about the treatment group and what treatments they were obtaining and whether or not that would affect them. And so, because of this, there could be placebo effect or observer bias, and there was no real way to eliminate that. Also, because there is such a small sample size due to mandatory discharge dates, there was not more people that could be included in this experiment, and always the more participants there is, the more reliable the results are. So to address these limitations in the future, a further double-blind study with a larger sample size would be required. All of this is really important, though, because it's vital information that could help the elderly in this day and age, these unprecedented times, where there's no real proven method of feeling better yet without rehabilitation. So it's a good stepping stone for future studies. So in conclusion, there was a 6-week respiratory rehabilitation that can improve respiratory function, quality of life, anxiety in elderly patients with COVID-19, but has no significant improvement in elderly depressive states or activities of daily living. So that is our presentation. That was like a mock of what you guys will just do. And it's always important to include the references with each thing. So there was some outside research done, so those are included along with the actual article that we did. And then we'd have a time for questions. So if anyone has any questions about the article that we chose just because it was applicable to everybody right now, but if anyone has any questions, feel free to ask. And if not, we can just move on to the activities.